So today we have a lady whose baby's breached. She's about to give birth next week. And so in the chiropractic world, what happens with a breached baby is there's this ligament that's tender and it's tense and it's not allowing the baby to turn. So it's connected to the sacrum or the tailbone. We're going to bend the two legs, and typically the leg that doesn't go as far is the side of restriction. And we can feel this, that the right side feels a little bit more restricted than the left side. So push over here, and this feels a little bit more resistant. So the right side is where we're going to do most of our treatment. So she's going to sit right there. Pretty, you don't have to move. We're going to just bring this into tension and push this. You okay?
Yeah, is it safe?
Oh yeah, it's safe. So, and a lot of moms who are pregnant, they want to know if it's safe. There is a pediatric certification, and every single doctor that's going to handle pregnant women needs to be certified by the International Chiropractic Pediatric Association. Interestingly enough, the Webster breech turning technique, which is named after Larry Webster, who pioneered the pediatric movement, was a teacher of mine. So we just do this, very, very, very gentle, very safe for the baby. In fact, a lot of moms who are pregnant receive chiropractic care. And so now we're going to just bring this back and, okay. Feel a difference pretty right now?
Yeah.
So it feels a little bit looser right here. So now this goes back a little bit more. But I'm still feeling a little restriction. So we want to make sure that there's no restriction in that side. So we'll just push a little bit with this machine and go right back to the leg check. And now we'll just push them. Okay. Feel the difference pretty? There we go. Now it just feels looser. And now what we're going to do is we're going to have you turn over and you're going to lay on your back. Now we're going to jump to the area that's causing restriction. Pretty, our patient is going to lay on your back, please. Yeah, no. And the side of restriction is the same side of what we're going to work with. So there's a ligament called the round ligament. You take the belly button, take the hip, crisscross, and typically, and there it is. And we'll push for about a minute or two, and we'll wait for this ligament to relax and become looser. And within 24 hours, the baby flips over. Do you feel this? You can put your foot down here.
Okay.
There we go. And so here's the point to your belly button. That's your belly button? Okay, so we go right here. Right there. There we go. There we go. Is it comfortable for you or a little uncomfortable?
Yeah.
It's okay?
Yeah.
There we go. Now for this technique, you don't do any other segments of the spine. You deal with the sacrum, the round ligament, you wait for the ligament to become looser, and that's the treatment for the day. It's very, very simple. The body knows how to heal itself. We just remove the interference and let nature take its course. There we go. About a minute ago, I felt a twang. Did you feel a little movement?
No.
It might have been your leg, but I don't feel that. There we go. There we go. You're done.
Done?
Yep, that's it.
Thank you.
You're welcome. How did that feel?
Yeah, I mean, maybe there was some stiffness, that was, actually stopping to move, baby to move. So maybe it will help. Yeah.
So I'm going to want you to check in with me tomorrow. Actually within 48 hours. So today's Wednesday.
So, not tomorrow?
Check in with me on Friday.
Friday.
Okay? I want to give it at least 48 hours
Okay.
for the baby to turn.
Sure.
But the ligament relaxed the baby should turn within the next 48 hours. If it doesn't, come back in one more time, and it should turn by that time.
Oh,
Okay?
So is there any like activity or like exercise I should do at home? Because I'm walking a lot, like about 3 to 5 miles a day.
Keep
then-
walking. There's no, listen, don't start anything new. Keep your body moving. Keep exercising. Eat, obviously, clean and healthy foods. But this over here is typically a sacral issue. Now, when you try to bend that right leg, that means the tailbone was moved a little towards the right side, and it wasn't allowing the full flexion of that knee, of the leg.
Okay.
So bring this back to center, flip you over. The opposite side is where the ligament's always going to be tight. You work that out, and it allows movement for the baby to take place.
Oh, okay.
Okay, so now keep doing your normal activities. You're obviously in great shape. Baby number 2.
Yeah.